Welcome to the Health Catalyst podcast, brought to you by YPO. Here we talk about the business of health innovation, and I sit down with industry leaders who have been in the trenches. My goal is to share the lessons and provide practical and actionable advice to help you launch, grow, and scale your business. I am your host, Rodrigo Hute. Hello and welcome, everyone. Welcome to the podcast. Today, I have two very special guests. I have Rob Coppedge and Troy Arnold. Rob is the CEO of Echo Health Ventures, a leading venture capital in the US healthcare industry. And Troy is a principal at Echo Health Venture. They both work on identifying, investing, and helping amazing growth stage healthcare companies in the US. In today's episode, we'll be discussing a number of things, but the most important one is we're going to talk about the complex payer ecosystem in the US. We're going to learn about how that works. We're also going to, Rob and Troy, they're going to share some insights into how Echo Health works with large health plans. And then finally, but not least, they're also going to be sharing insights around how health plans are thinking about opportunities. So Rob and Troy, thank you so much for being here today and welcome to the podcast.
Thanks for having us.
Thank you.
Great. Thank you so much for making the time to be here. I would love to start with question, if you can share a little bit about Echo Health and how you're structured, sure. Just for everybody to understand a little bit more about.
Sure,
Echo
thanks.
Health.
Yeah, no, happy to explain it. We're a little bit of a different kind of beast, Rodrigo, in that we do work like a normal venture capital fund would, and that we invest in early stage companies, growth stage companies. We go on boards. We do all the things you'd expect a venture capital fund to do, but we do it with two motivations: returns, like a traditional venture capital fund, but also generating strategic value for 4 health plans who are our sponsors. We work with Blue Cross Blue Shield of North Carolina, Tennessee, Arkansas, and the Regents plans out here in the Northwest that cover Washington, Oregon, Idaho, and Utah. And they view Echo not so much as a part of their treasury function where we go get returns and kind of don't care how we get it. They view us as a strategic tool that they can use to connect their business to the innovation ecosystem, the innovation economy. So I think of us, even though we are a venture capital investor, we operate that way. I think of us much more as venture being used as a tactic to advance a broader strategy that's important to these very consequential regional plans that serve over 11 million members across 7 states and all lines of business in the U.S. So you look at our portfolio today, I love the portfolio that we've built from a returns perspective, but I'm even more proud that over 75% of the portfolio is commercially attached, working with one of or more than one of those 4 plans. And I tell you, for folks who are selling into health plans out there, you will appreciate the difficulty of selling into health plans and and I think the value then of having an investor that can help you navigate both the priorities and the sales cycles and getting product market fit for these large buyers of your services. So that's us. I'm based out here in the Northwest, and Troy's based in our North Carolina office. We tend to work very closely geographically to the 4 plans that are part of our alliance.
And how many companies have you guys invested over time?
Well, currently the portfolio is about 25 companies.
25.
And we're stage agnostic. Because of our structure, we can do everything from, we have the opportunity to go very early and back entrepreneurs with good ideas, all the way up to doing, when they existed in the world, doing pre-IPO rounds. And so we can go up and down the scale that way. And we don't think of ourselves, again, sort of wedded to a traditional venture fund model, and that we can act more like a growth equity investor, act more like a private equity investor, all those tools being used to advance the strategies of the plans we work with.
All right. Thank you. Thank you for that. I'm gonna start with a very basic question. For someone who's trying to understand the craziness of the US healthcare market, what are the different, the most basic level, what are the most different types of payers in the US?
Troy, you want to take this one? I feel like you're most qualified to explain the system to us all.
So I think your podcast would need to be substantially longer to dig into a tremendous amount of detail, the U.S. healthcare system. But one of the easiest ways to think about it is you've got public, which you've got through CMS, you've got standard Medicare. That would also include some of the Medicaid plans. You've got private, and under the private, you have both for-profit plans and not-for-profit plans, such as the 4 Blues that we work with. Then you have some integrated institutions, which actually have both the health delivery side as well as the health insurance side. Kaiser is the one a lot of people think of when they think of that. So you have a multitude of plans that exist in order to take on financial risk, but also support the care and advance the quality of their members and the patients. How an entrepreneur, particularly somebody trying to grow a small company, works with them is unique. The majority of them will work with the private, not necessarily the public, except in some institutions at CMS or some programs that CMS has created over the past few years. They've been extremely innovative in some care delivery around specialty models, as well as primary care models. Other ones, such as entrepreneurs that might be thinking about more back office entrepreneurship or other types of administrative tools, I would imagine typically start on the private side. So it's a wealth of different opportunities. Each one thinks about partnering and working with those new entrepreneurs in different ways, which adds to the complexity to small companies. So unfortunately, approaching a private not-for-profit is usually very different than approaching a public insurer, and it just takes a lot of flexibility on their behalf in order to understand those nuances.
And just to add a little more complexity to it, you think about some of the tools that people are trying to sell into health plans. Oftentimes they may start selling in by going to large employers who then also work with health plans to administer their plans. And so it may be an easier path, and we can talk about this later in the conversation, but it may be an easier path for a startup to go in through a large employer at various points in time than to go in through a plan. Ultimately, you're trying to get to the same place. How do I serve a population with this tool or this service? And so there's some strategy based upon both the services being sold and the motivations of the groups, and also where you are in a cycle. And I think we're in a unique point in the cycle right now, but where you pick that entry point. That can be a very important part of strategy for a startup company.
Yeah, absolutely. And if we think about private health plans, which you mentioned that Echo spends most of the time like working with 4 Blues, large health plans in the US. Like, what can you share about their psychology? Like, how do they think? What are their priorities? How do they make decisions? What can you share about that?
Yeah, I'll take a stab at this, Troy, and then you should jump in here. It's probably important to say to start off that Troy is probably uniquely qualified to speak to these things, because in Echo's structure, we have an investment team that's out doing deals the way you'd see a venture firm doing deals. We have a team of people who also embed back in to these 4 plans, not to go sell them stuff, but to help make sure we're getting the right signal to advance our investment priorities, and then to help our portfolio, once we've invested, navigate the plan. So Troy is part of the team that navigates these health plans. He's also his background is that he started his career, and it's been a large amount of his career inside institutional healthcare, including the Blues. And so whenever I have a question about how to navigate a Blue plan, I go to ask Troy. So I'm glad he's here to help us today. But I'd say the set of priorities and the things that are on the minds of health plans right now, I think it's I guess a couple of things to set the table. The first is if you're talking about a Blues plan, especially a not-for-profit Blue Cross Blue Shield plan, they have a different set of thoughts and concerns and motivations than United or Aetna or CVS, right? Or Cigna. And that's largely because their margin goals are different. These plans are in the community. They have a public good that they're pursuing. Many of them, especially in the Southeast, cover a large percentage of the population in those states. And so they are, they are a part of, they're a part of the community in a way that the large nationals and the for-profits are not. And just to be fair. That being said, all plans right now are hyper-focused on an increasingly challenging competitive environment. A lot of the rules around how Medicare reimburses are changing, and that had been a cash cow for some of these plans for the past decade, and that is changing. And so there's a lot of pressure on plans now, both Blues and the large nationals. And so when one says, how do I navigate and how do I get the attention of and what matters to these plans, you first need to know who you're talking to, and it's going to be a little different no matter where you go in, what your sale point is. And then the motivations from the different stakeholders inside these plans is different as well. You're talking to the CMO, they have ideas about which would be the chief medical officer. They have concerns about quality. They have concerns about network design. They have concerns that relate to the clinical setup of their market. You talk to the CFO, they may have a few different ideas on their mind. And so, Troy, with that, maybe talk a little bit about how some of our companies have what they have learned most recently, because we just had a summit of all these stakeholders from across our portfolio. What are some of the big takeaways we've learned in the past 3 to 4 months about what's on their mind?
Yeah, so a couple things come to mind, Rodrigo. One of the sort of a broad sweeping statement is that when you think across Blues or private insurers at the highest level, as Rob was referencing, many of them have similar goals in mind. They want to drive quality and outcomes for their members. They want to drive down medical expense, administrative expense. They want to improve the experience and engagement, not only for their provider and network community, but for their members too. But the secondary step, the next layer down, is where the complexity really starts to come into play. Each Blue has a different structure. Each insurer has a different structure within the state or the geography that they cover. They have a different set of priorities given whether or not they're in certain markets. Some insurers are in a managed Medicaid environment. Some are not. Some are in the Medicare Advantage space. Some are not. And then even within the commercial side, many have very large, fully insured sides, but smaller ASO, smaller administrative service only sides. Other Blues are the other way around. So I think what's incumbent upon entrepreneurs early on is to understand the value prop that they have in their tool, their service, and then which side or which set of populations they think it most applies to. Probably one of the things that payers dislike is when they hear really broad sweeping statements, because what they're trying to figure out is, where would this fit within my ecosystem? How could I take advantage of this particular tool? And payers, it's no surprise, are very large bureaucratic organizations with a lot of priorities. So they early on, there's only a limited window with which a smaller company or an entrepreneur has to really find that spark, to really find that idea. So they need to have done their homework ahead of time. What I would recommend is that they're thinking about it, they really understand, to Rob's point, the market in which that they're trying to fit into, because they all have a different set of priorities. And sometimes those priorities are driven by outsized regulators and rules around things like risk adjustment factors or quality scores. And sometimes it's driven by the population of which they have as most of their members. But I think some of the broad pieces I think are really important. As you're coming in, are you looking to try and create a tool that has a direct to a member impact? Or some of the companies, particularly in our portfolio, I would call administrative or back office. So they need to make sure they're talking to the operations side of the house. It really depends on where their value is as to what resonance they're going to have when they talk to plans.
Can I just say, it's interesting, Troy, we can think of many occasions of this where you got a plan that has a need and you got a company that could address that need, but they've gotten the call point wrong. They're going into the plan at the wrong place. And so they're hitting a brick wall they shouldn't be hitting, or they are getting false positives from these conversations where they think they're making progress, but they're selling to the wrong person. They're selling to the wrong team. And that happens more times than you'd care to admit as you look across this. I mean, it's just so complicated. Knowing that you're selling into the right place with the right message is kind of the first step.
Yeah, that makes sense. Are companies taking a national approach, or are most companies trying to do like a local geographic approach? Because based on what Troy is saying, it probably makes sense to start somewhere very specific, because otherwise it's too general. Everybody has different
Yeah.
priorities.
So I would say it's rare that I meet a company that doesn't want to take a national approach, and then we have conversations to focus them down. It's even with large national payers, they will, on a rare occasion, give you a national contract. Even somebody that covers the entire U.S., think of United, Aetna, Cigna, they will many times, the initial contract that they would give, the initial partnership, is really based on trying to understand proof of concept, opportunity, rollout plan. Is it really going to perform the way that I think it is? So they end up with very narrow opportunities and then build from there. So I would always encourage them to think more locally. National is a great aspiration, but I think thinking locally is where they're going to get the traction.
And if you're a company thinking locally initially in a given state, for example, and would it make sense to focus on one plan, multiple plans, or you know what I mean? It's like there are so many options to go. So how do you make strategic decisions as a company? You know.
Oh, I think it depends a lot upon what your service is or what your technology is. Because some cases you need the market. It's your business model to need to have density in a market. In some cases, it would serve your benefit or serve your purposes to go test and learn with one payer in this market and a different kind of payer in a different market. And so I think it just depends. I'd say it's the difficulty of trying to sell multiple payers in a single market on one solution and get them all on board that's a challenge I probably would not sign up for. Or I'd want to really de-risk it somehow before I got into it. As an investor, I want to see there was some reason why this might work in this case, because it's pretty hard to do otherwise. Now, I mean, I'll say this is less a health plan thing than a health system thing, but like oftentimes entrepreneurs, especially earlier stage folks, will think they've sold a national account. They'll be like, yeah, I got HCA. And then they realize what they've got is a license to hunt and go then sell different regions of HCA or different systems within. And so this idea of, yeah, you may spend all this time selling nationally, and what you've really done is gotten yourself the ability to go sell locally. Mm-hmm. And that's certainly true among some multi-state health plans where you know the home office will make a decision potentially, but very rarely are they going to jam things down on their local markets, especially among the blues.
Right. Let's talk about a company that has done a good job. Maybe there is an example in your portfolio or a company outside of your portfolio that has done a good job at doing what you're suggesting. Like they have a new product or a new service they're trying to enter and convince the health plan to reimburse for something. I think it would make sense to talk about the specifics of one example to add some color to it.
Yeah, you got an idea?
There's a few that I think we could talk about that have taken different approaches. One of the ones that we were actually just with them recently at our event is, and I think many people would know them and could look at the model, is a company called Aledade. So we've been an investor in Aledade for quite some time. What Aledade does is they actually support primary care practices in order to really achieve success in value-based care arrangements. And this is what Aledade is unique, especially for this conversation, in that they support those primary care practices in value-based care arrangements run through CMS, federal government, as well as value-based care arrangements that are run through private insurers too. And what's unique, and this was maybe the next question on your mind, Rodrigo, is Aledade, like many organizations, really ends up putting themselves in the middle. So they not only have to develop relationships with providers, they also have to develop relationships with the payers. So they actually have a double-sided opportunity and hurdle, if you want to think about that. What I've been impressed to watch them develop over the last number of years is where they've really been thoughtful about the markets that they enter. They look for density, they look for opportunities, they look for areas with substantial primary care practices that are still independent, that fit their profile. And then they've been able to show success and find partnerships. One of their largest relationships is actually with Blue Cross of North Carolina, at least across the Blues. And they partnered to help grow in the state of North Carolina and have had generated tremendous success. But it's over time. Even a company as large as Aledade was at one point relatively small, and that they really had to grow up through all those relationships. And those relationships grow not only through just personal relationships in order to give them the springboard, but then you have to show results. That's sort of the second phase. Once you get the opportunity, you then have to continue to show the results year over year. And I think that's a company that's done that. We've got companies also in our portfolio that are earlier and maybe less familiar, and I think they've also done a good job. But so maybe taking another tact would be, let's see, an organization that we've worked with for the past few years that most people wouldn't know by name necessarily, but they do the same thing. It's a company called VaxCare. And VaxCare actually supports the vaccine distribution administration amongst a number of primary care and specialties. They've had to grow very step by step. They would pick a state as an opportunity. They would look at the market. They then would sign up with payers through a contract, but then also have to sign up relationships with providers. So you're probably sensing a theme here is that you have to prioritize, be methodical about it, but then you have to really go through all of your contracts and grow over time.
Yep. Yeah. Thank you. I would imagine that, especially with value-based care. I'm gonna talk about that just for a little bit, but I've always struggled with the definition of value. Like, what does value really mean? And I don't know. Maybe you have some insights, or maybe you have an example. But I would imagine that it really depends on, that you can decide what value means. And it's really based on the contract, right? It's not just I want to reduce costs and share the savings.
I wish the definitions were that easy. Yes, This is defined very, very in very detailed terms at the contract level, and Troy has spent a lot of time sort of going through these for each individual company, with each individual plan. There's some commonalities, but there's certainly things that are specific to what each of these companies can do and what they can deliver in the market, and then who's ultimately accountable for that value being brought to bear. And there's a lot of wrangling over this still, Rodrigo. I mean, I think a lot of folks, this is a concept that we all believe in, that we ought to pay for value, not for volume. But to put it into practice requires, a lot of sophistication and nuance. And I think all the counterparties are still kind of continuing to refine how they do this. And, Troy, maybe there's some examples from the portfolio of, I think it's hard to go sell a simple PPM kind of deal into a health plan. Going and crafting a value-based arrangement is also it's like going to grad school. Maybe you want to talk about one of those.
Yeah. So it's a great point. And Rodrigo, similarly, I wish the definition was simpler, but one of the ways that I've learned over time is when you meet a lot of early stage companies, a lot of them will say that they're in value-based care or they want to work in value-based care. And we've learned to go through a very set of unpacking of those statements to really understand what they mean, because there's a whole lot of nuances. It's any value-based care today probably is a definition that's anything other than straight fee for service. So the easiest way to say is if it's not fee for service, it tends to be called value. Mm-hmm. You can have simple things, simple in the relative sense of bundles. So orthopedic bundles is a familiar topic that many people know. Is you pay a fixed price for a particular surgery, but then you can go all the way to even as broad as full risk models. So, which is where we have several companies that are doing that, meaning these companies, some of them actually deliver care, some of them actually support the delivery of care, but they partner with payers to generate improved quality and outcomes, ideally at a lower medical expense. So the more traditional sense of value. But how they do that is relatively complex. So Aledade, for example, does that for all lines of business working with primary care. We have a company that does that for a Medicaid focus called CityBlock. So we've seen multiple different lines of business. But the short of it is those companies have to take into a whole set of other considerations. So when you take risk for a population, you then have to understand that population very deeply. So certain elements become critically important when you start to put that risk on yourself. You have to have data information about that population. You have to have good predictive analytics to understand where you've got subsets of populations that are driving costs because their quality and outcomes aren't doing well. And some of those statistical models have become quite robust, and you can actually get ahead of some people that are starting to show signs of becoming sicker, more expensive, and drive better outcomes. But maybe the most important element of success in value-based care is really the relationship between the payer, this company, and the providers. The payer, the patient or the member tends to be in the middle, and they've got a limited bandwidth with which to respond. And what we've found over time is that if they get reach outs from plans, from providers, and these institutions, they don't do anything. So the best way to do this is understand who's on first, and you've got to prioritize these relationships. So I'd say value-based care fundamentally is a better relationship amongst all the players to drive better outcomes at a lower cost for the patients. The devil is surely in the details of that model.
Yeah. And on that topic of building relationships, you've mentioned this a couple of times during the podcast, but building relationships and partnerships takes time. Right. Especially in this industry, there are a lot of incumbents and a lot of relationships that have been forged over the years. How could emerging companies approach building relationships if they are running against the clock? You raise venture capital, right? You raise venture capital, and then you have 18 months to prove that you have product market fit, that you have generated some traction. But then, building relationships takes time, so
Takes time.
Like, what do you think about that? And what advice would you give someone who's building a company and that might not have years and years of relationships in a particular market? Yeah.
I've got two thoughts, and then Troy, I'd love to hear yours. But one is to be focused, right, and to kind of go in collaboratively to problem solve together. It's change your message enough so that you stand out from the crowd. If you're going in to try to build new relationships with enterprise stakeholders in healthcare, try to not be the person who's coming in just trying to sell them something. Come in trying to solve a problem in the market and differentiate yourself that way by being a true partner. It's hard to do, and I say it's even harder to do today post-COVID. I think you're seeing less opportunity to kind of for new relationships to be forged because people are just not out there as much as they used to be. And so, I was going to say my first piece of advice is not to go to health and pretend that health is the way that you do this. Although it may be the only way to do this, to be honest with you, because it's one place where everybody goes. However, I don't see there's a lot of substance there. I think there's a lot of opportunities there that are being monetized to pretend you're building relationships, but in fact you may not be. The second place I'd say is in addition to what you can do yourself to be very focused and problem solving in your approach, if you're raising capital, try to raise it from people who can actually help you. And I say actually, I know I'm in the corporate venture world, so I'm going to shill for corporate venture for a second. But I'd say all of us aren't created equal either. There's some really good financial VCs that are out there that have true high quality relationships that they can leverage for their portfolio. And those guys are great. And there's some that say they do and they don't. And so And in that world, it's the same goes for corporate venture too. Some of us are really good at navigating the hallways of our parent companies and our sponsoring organizations, and some of us are not so good at it, or the organizations themselves are not so good at partnering. So really doing your homework on whose capital you're taking and how they can help you. I know that's an easy thing to say when I'm not facing a cash flow challenge and I don't need to raise capital right now myself. And I've been in that spot and I understand it. It's you need money and you got to pay the bills. But if you get the chance to be discerning, call references on the funds you're talking to, really explore what they've actually done, not just picking up the phone to say, talk to the CFO or the treasurer of this plan, but how have they helped their portfolio navigate these things and sort of accelerate the path of product market fit? So, I mean, again, finding ways to be truly collaborative and partnership oriented by differentiating yourself that way, and then picking your investors and to the extent you can to find folks who can extend their trust factor to you. So, what would you add to that?
I really like that perspective, especially as early stage companies and entrepreneurs are looking to find those initial relationships. Maybe, Rodrigo, I might take the other side of where you were asking is, how do you maintain those relationships? Because typically I would say once you started to get a good name for yourself in the ecosystem, you'll have people looking for you too. It's a relatively small community and people talk quite often. And probably a couple things that I would say are critical, and these sound maybe like oversimplifications, but you'd be amazed how often it doesn't happen. The first is, I think these companies need to be extremely honest with their potential partners on exactly where they are in their development stage of their product. Many times we'll hear the pitch, and the pitch is really for the vision of the product, not necessarily what they have today. What I'll say is that if companies that are very honest and they can deliver both at the same time, their vision, how they're going to get there, and then where they are today, it tends to generate a pretty significant amount of goodwill with potential payers because they appreciate the transparency. Many of them will tell you they've got stories where they've signed up for something and it's 10% of what they thought they were getting, and they're 3 years into the relationship. They're mutually frustrated with one another, and then they really have to move on. So I would say early on, demonstrate some openness and some transparency. Second piece is a level of ongoing communication both ways. Make sure as an entrepreneur, you continue to understand the problem you're solving. It evolves. Things happen, they change in the market, and you need to really make sure you understand, am I solving the problem the Blues have asked me to solve? Or my payer has asked me to solve? And then secondarily, be extremely open with how well you're performing. If you've hit a roadblock, even if it's not in the contract, these plans want you to succeed. They've put a lot of money, effort, time, and resources, and sometimes a little bit of their namesake on the line by bringing you in to help solve a problem. And if you hit a roadblock that neither of you were anticipating, even if you don't think it's written in the contract, you should ask. Ask for help. Ask for introductions. Ask to rethink about a new data file that you realize would solve it better than the one you're getting today. There's a mutual benefit in that. And I think those attributes, those actions, characteristics, I think will serve these early stage companies very well in the long term.
Very, very good point. Yeah, thanks for sharing that. On the same note, and I know this might vary a lot depending on what product or service we're talking about, but generally speaking, what is the role of clinical evidence, of building clinical evidence, clinical trials, and also perhaps pilots, like pilot programs that you run with a health plan? Everybody, when they are trying to sell or partner with a health plan, they are asked, okay, show me the evidence, or let's run a pilot. And similarly with building relationships, that takes time, effort, and resources, and it can take a while. So, how critical is that in your view? Critical strategy, to really build that relationship and that reputation within a health plan.
So I'll give a couple of points, and Rob, I know you've seen this too, so would love your perspective. So I would say if you're a company who doesn't have much evidence yet, whether it's clinical evidence or just enough reps so that you can demonstrate the effectiveness of whatever product or solution you're selling, I would say you're uniquely going to want to look for the right payer partner. Some are well built internally, or also how they have relationships in the market where they can bring on very early companies. It's a potentially a very unique problem for the payer or the partner, and they're looking for somebody to try things out. Other payers don't have that flexibility, and there's just a lot of variables, and you're going to want to make sure you've done your homework to understand, have you found somebody who has that flexibility? The second piece I would say is that when you're developing those results, or when you're developing that information, you'll want to pay very close attention just to the data, the elements. You're going to want to make sure that you can defend what you're putting together, because I think it will be really important to help you demonstrate the success. So there are some stories where you'll hear about plans are uniquely situated to do what they call coverage for evidence development, where they actually knowingly go into a partnership where there isn't much, but they believe in that particular solution substantially. And other plans really just avoid it because they're just not well built to help a company develop that evidence. Last comment I'll mention is on pilots. Pilots is probably a pretty divisive term. So I heard somebody describe a pilot as the last bus stop before the graveyard. So it's basically like they just won't do it, because the problem with pilots is a lot of times you'll have an organization that has just enough funding for the pilot. You'll get something started. It's too short to really develop enough evidence to prove whether or not it worked or not. And there's no budget or plan on the other side of it. So you end up as an entrepreneur putting a tremendous amount of your time, energy, blood, sweat, and tears into it. And there's never a year two. So rather what they'll try and do is they'll try and create opportunities for 3-4 year contracts with milestones. So what that does is that essentially it forces, if you will, the partners to envision an opportunity that's long term, but there'll be a really hard milestone at the end of year one. Say, if it's not working, we're going to end this. And that usually helps change the dialogue a bit more than just a pilot.
Than just a pilot, yeah, that makes sense. All right, Rob, you were gonna add something else, or no?
No, Troy nailed it. I have nothing to add to that. I think, although I may borrow his line about pilots being the last stop before the graveyard, because I have I've seen companies go straight to the graveyard after them. So I think it's a very fair assessment.
Yeah, absolutely. Yeah. All right. So let me ask the final question before we wrap up, and that's looking ahead. Like if we look beyond 2024, we look to 2025. What are some of the top opportunities and priorities for payers, and in particularly, the four that you work with? If we talk about the four blues that you have partnered with, how are they thinking about the future? What are some of the key opportunities and priorities ahead?
Troy, I think you should just given the fact we've had all this time with these four plans so recently, I think we have a pretty good sense about where their heads are going forward. Why don't you share some of that?
So, Rodrigo, I'd probably say that there's a few we could talk about, but the ones that come to mind is one. There's a general environment priority. What I would say by that is most plans nationally, and it's been in the press substantially, have had a lot of headwinds as it relates to their Medicare Advantage plans. There's been a lot of changes that CMS has put through recently around things like risk RAF scores. They also have changed some of the STARS methodology around quality. And then it's unseen yet. We won't know until the first week or two of January, until the final numbers shake out, that some of the populations will be shrinking, sometimes purposefully. Some plans are exiting the Medicare Advantage book, but other plans are bracing for potentially lower volumes of people. So that particular line of business generally generates a nice margin for many plans. So it's a bit uncertain what that looks like. going forward. So those are just kind of some macro trends. The other ones that we're seeing is that through just the evolution of time, there's been a number of entrepreneurs and smaller and sometimes even larger stage companies that have generated really good results on both quality as well as financial results on what 10 years ago would have been considered a narrow business model. So around a condition. So in addition to 10, 15 years ago, you would regularly hear about companies that focus solely on diabetes. You actually have a number of companies that are generating a huge amount of success across the board: cardiology, MSK. You've got oncology companies, CKD companies, and ESRD companies. Mental health is big, and there's even subsections that focus on juvenile mental health versus adult mental health. Those are opportunities, but they're also a double-edged sword in that payers then have to figure out how to thread all of these clinical opportunities together in a cohesive set that makes sense to me as a consumer. So plans are starting to really think about their members as consumers in the sense that they have choices. And if you overwhelm them, unfortunately, as I mentioned earlier, they typically do nothing. So they really have to give some thought to, I want to have all these great partners, but I need to understand how I can make sense of this. So lots of priorities that they're thinking of, which I think will be interesting to watch.
All right. Thank you. All right. Thank you. So this is the end of today's interview. Troy, Rob, thank you so much for your time today and for sharing your insights. And thanks everybody else for watching and listening. So thank you. And until
Thanks for
the next
having
time.
us.
Thanks, Rodrigo.
Absolutely. Thank you.
Yeah. Thank you. Take care. Bye.
Take care.